if your health takes a turn for the worse, are you going to be taken care of? John, you mentioned Medicare and the things that it covers and the things that it doesn't. And one of the things that many people are shocked to find out is that it does not cover any long-term care costs that may arise. And when I say may, statistically speaking, it's a 7 in 10 chance that we're going to need some sort of long-term care in retirement.
You're right, Scott. And there is a Medicare provision for rehabilitative care in the long-term care realm. But when you think about home health care, when you think about nursing home care, that is not covered by Medicare. Medicare stops at the nursing home door for all intents and purposes. And so if you have a debilitating issue when you are older and you have to be cared for at home or you have to be cared for in a nursing facility, you've either got to pay for that yourself or you've got to have long-term care coverage, or you have to deplete all of your assets so you go on Medicaid, which is a pauper's state program that provides minimal custodial care in a nursing home setting, no home health care for Medicaid. And so it's really one of those things, Janet, that as you think about the dynamic of that and how someone would want to be cared for, first of all, I don't know anybody that wants to go to the nursing home. It's not a place that people really, aspire to be at, but you do know that you're going to have some resource for that.
Yeah, absolutely. And John, I think you hit on one of the reasons that people are confused and think that their needs in this arena would be covered by Medicare, and that is Medicaid. I think the names just confuse people. They get them mixed up. So I'm just going to give you an easy way to remember this. Medicare is something that is used to care for the elderly. So when you turn 65, you get Medicare at that point. Okay, it doesn't matter how much money you have or don't have, you can get Medicare then. But Medicaid, you aid the impoverished, care for the elderly, aid the impoverished. And so if you have gone through the financial resources that you have and you're at a point where you don't have the ability to pay for your care anymore, then Medicare is not going to provide that for you, because they are here to help you with your medical needs to the point that you are still improving. But when we get to the point where it's a long-term care situation, they're not going to do that. So if you don't have insurance that steps in and you can't pay on your own, then you spend down your assets, and that's when Medicaid steps in. And as you referenced, John, it's a different level of care. And not that anybody wants to be in a facility of any type, but you certainly don't want to be there under a Medicaid situation. So you want to look at how do you purchase throughout the rest of your lifetime, how do you purchase your dignity and your independence? And you don't want it to be dependent upon a government program to do that.